Hi there, my name is Dr. Mashhood Qazi. I'm a consultant in emergency medicine and you're watching my YouTube channel. If you like this video on this channel, please kindly subscribe to this channel. I was wanting to talk about this topic for a while, but because there were some other issues such as COVID, vaccines and things like that, I couldn't make this video for a while. It's an important video for the junior doctors and the young medical graduates who want to excel in their profession. Currently, the UK NHS has a lot of great opportunities. By the way, the disclaimer is I am not making this video on recommendation for any recruitment agency or any hospital. I'm making this video solely because I want to provide this information to the young medical graduates and the young doctors who are trying to excel in their field. As I mentioned, currently there's a lot of opportunities, a lot of openings in NHS in the UK, especially in the emergency medicine. Why do I know this? The reason I know this because I currently do work in the NHS. I have strong links with people who work in the NHS. I know the system inside out. NHS is one of the best medical healthcare systems around the world. So there is no doubt that if you do end up working for the NHS and end up choosing a career in the NHS, you're probably going to excel far better than if you weren't. The reason there is a high demand for graduates, especially the international medical graduates in the NHS, especially in the emergency department, is because, as you know, the emergency departments are and have been under a lot of stress with the work overload recently, especially prior to the COVID pandemic. There was always the mention of the winter pressures, the bed pressures, and the COVID pandemic has actually made these issues slightly worse than before. Things are improving. The NHS capacity is improving. A lot of work has been done, no doubt. But for the international graduates from countries in the subcontinent, India, Pakistan, Sri Lanka, Bangladesh, and especially in the Arab countries such as Egypt, Iraq, and South Africa, not to mention Nigeria. A lot of doctors come to the UK NHS from Nigeria. There is definitely, no doubt, a lot of opportunities. The NHS, if people have studied NHS in slight details, goes through certain cycles every 3 to 4 years. Every 3 to 4 years, there's a lot of opportunity which comes up. It absorbs a lot of medical doctors from around the world. Then the opportunities slow down. Then the cycle repeats every 3-4 years. And we are currently at the part of the cycle where the NHS needs graduates, needs medical doctors from around the world. So no doubt, if you are planning to come to work in UK NHS, this is the right time to come to. There are a couple of reasons for that. First one is certain degrees, certain postgrad degrees are getting exempted from the PLAB exam. As you all know, PLAB exam is necessary to get the license to work in the UK NHS. So certain exams, if you pass, such as the MRChem, MRCP, you are exempted from going through the PLAB examination. Not all, but some of the postgraduate degrees, and especially if you talk about the emergency medicine, if you have an MRChem degree, you will be exempted to do the PLAB. Not just the PLAB, the English language assessment test, which is normally called IELTS, ILETS, can also be exempted in a lot of cases. In graduates, doctors who are getting MRChem and MRCP degrees, PLAB and IELTS exams are exempt. So this is a great bonus. It doesn't happen all the time, but currently, because NHS, just like any other healthcare system around the world, is facing unprecedented demand. So these opportunities are coming up. So why should one work in NHS or UK? First of all, and the most important reason, because the NHS is a very well-established postgraduate training place. It has postgraduate exams, training which is well recognized all around the world. So there is no doubt it stands shoulder by shoulder along the best healthcare systems around the world. So currently, if you don't know what to do, but you still want to work in the NHS, there's a lot of recruitment agencies around the world which hire doctors from the country of origin, then take them to the NHS. I do know a lot of very good recruitment agencies, so if you can't find any of them, do let me know and I can direct to them. But do consider coming to UK and getting some good postgraduate qualification degrees. Then if you don't want to settle in the UK, you can always go back to the country of origin and utilize your postgraduate training and the degrees you get in UK. But believe me, this is the time. If you ever planning to come to the UK, this is the time. This is the time to take advantage of the opportunities which are out there, especially in emergency medicine, which are plenty. Hope you like this video. If you have any questions, feel free to comment on the YouTube video or WhatsApp me. I'll do my best to get you as soon as possible. If you like this video, do kindly subscribe to this channel. Thanks a lot.